Everybody set? Okay. Good afternoon. My name is Michael Resnick. I am the Director of Public Safety for the City of Philadelphia. With me is Deputy Commissioner Dave Gallagher, Deputy Commissioner in charge of EMT Services at the Fire Department, and Deputy Commissioner Derek Sawyer, Deputy Commissioner of Operations at the Fire Department. Tomorrow, the Civil Service Commission will consider the creation of a new class of employee, a fire service paramedic. The new class of employee will allow the Fire Department to implement a new deployment plan. We will have one EMT and one paramedic on each of our ambulances. This deployment model has been in development for many, many months, and it grew out of the Berkshire Advisors Efficiency Study. And let me just quote you for a second what they said. The current practice of staffing ALS units, that's advanced life-saving units, with 2 paramedics is unnecessary. State standards only require that 1 paramedic and 1 EMT be assigned to an ALS unit. So other jurisdictions staff this way. This will be a best practice for the City of Philadelphia, and in fact, the City of Philadelphia has been staffing this way for over a decade now. Generally, on any given day, we average about 30 to 35% of our ALS units are mixed staff with 1 EMT, which is a firefighter, and 1 paramedic. And we've been as high as, in the past couple of months, as 75% of our units have been staffed with 1 EMT and with 1 firefighter. I'm going to turn it over now to Deputy Commissioner Sawyer, who will introduce Deputy Gallagher, and Deputy Gallagher will go in depth with the deployment plan, and then we'll take your questions.
Good afternoon. On behalf of Fire Commissioner Lloyd Ayers, I would like to introduce to you the new Deputy Commissioner of EMS, David Gallagher. David Gallagher comes to us with 28 years of experience in the fire service, so I would like everyone in the city to welcome him. Deputy Commissioner Gallagher is going to speak on the current future of EMS in the city of Philadelphia.
Thank you, everybody. Today I've been asked to address some of the items in the plan that will give us an opportunity to redeploy our resources within the city. When you consider the development in redeployment models, there's many factors that you have to consider. This one aspect, the fire service EMT, that the Civil Service Commission is considering enacting, is only one component of a very large overview and system retooling that we're trying to do. When you look at how you want to deploy your resources, in best practices, they take a 360-degree approach to how they want to set their system up. That takes everything from your geography, the types of calls you get, your response times, the targets of your response times, the administrative support that you have, the quality of care that you want to provide, which is our main target here, is the level of quality when we want to supply. In addition to that, the city is undertaking a new dispatch program called Priority Medical Dispatch. And in preparation for that, we do not completely know the impact that that's going to have on our current resources. And the concerns that we're trying to address in our redeployment plan include the number of paramedics we have available and distributed throughout the city, the number of ambulances that we have, the number of supervisors that we have, the number of administrative support staff that we have, the quality care review component of our system. And we want to address the fact that currently in our deployment today, we are sending 2 EMTs in cases where they may end up on a critical call. We are sending 2 paramedics on a basic call that maybe neither of them are needed on. So we're trying to distribute all of our resources equally 7 days a week. Right now, we do not staff equally 7 days a week. Right now, we do not have our paramedics distributed across the entire city equally. We have them both on 1 unit. So the concerns that exist are that we're going to decrease the ability to provide each and every one of you, every resident, less. We're not doing that in any capacity. Everything that we are focusing on is an increase. Increase in ambulances, increase in paramedic distribution, increase in total staffed units per day, 7 days a week. And some days of the week on Saturday and Sunday, the staffing is going to go up practically 8 ambulances a day. And those are significant impacts that we're looking to have on the system. Other concerns that we're very aware of that the paramedics may have, and that's losing their partner, losing that support of having another paramedic in the ambulance. Under some guidelines that exist nationally, it states you should have 2 paramedics on particular types of calls, the advanced life support calls, critical calls. Our goal is to place paramedics, in addition to all of this, into SUVs. We're going to put the paramedics, which is another national trend in developing best practices, we're going to put those paramedics on SUVs. They're going to have supervisory responsibilities. They will be the second paramedic. We'll give 1 paramedic and an EMT on every call, and if needed, we'll be able to give an extra paramedic for that backup that they may need. We are in agreement with some concerns that the membership have that we may not have enough of those. And the pace at which this will be integrated, we'll be able to evaluate that within a very short period of time. And I have the full support of the administration and the fire commissioner that we can expand that paramedic support mechanism to the single provider. So we're not going to be lessening any of our ability to protect the residents of Philadelphia. We're increasing it. And the #1 measurement that they typically use is out-of-hospital cardiac arrests. And our goal is to get as many paramedics on as many of those as possible. Currently, we may end up with 2 EMTs on an ambulance when that occurs, while 2 paramedics are on a basic call. If we broaden our entire distribution, we may get a paramedic on every one of those calls, plus a second paramedic is our goal. We're looking at putting them in SUVs, and we've already talked with the membership about putting them on paramedic engine companies. So this plan is very 360-degree focused. In addition, this plan doesn't even just build out on the operational side. This plan builds out on the administrative side, measuring the quality of care that we do, increasing the training that we do, increasing the community risk reduction that we want to do on the healthcare side. We have a very strong community risk reduction program for fire prevention. We want to find ways to integrate EMS into that aspect of it. And by integrating it in there, that's going to start to develop partnerships between the department and further integrate it. We're also looking for ways to develop partnerships with mental health, public health, and ways to educate the public on what actually could sometimes be an overuse of the 911 system. Our goal is to give them options and alternatives. So we do agree that some best practices are out there. We do believe that we are developing those best practices just like the other cities, and we're pretty confident that we're going to take the lead on that very shortly. So if anybody has any questions, we'll be happy to answer them.
The amount of calls you get now in terms of where a paramedic may be needed, I mean, are you seeing a reduction in those types of calls where you actually need a paramedic?
Well, it all depends on, I mean, what we've currently done or what we're seeing.
What you're seeing.
I can give you last year's data, and this is where the dispatch comes into play. Last year, we dispatched approximately 100,000 calls that were called advanced life support. That meant they met a certain criteria. We dispatched 41,000 basic life supports. We dispatched approximately 23,000 traumas, and we dispatched approximately 8,000 calls to private medical facilities within the city. That's the dispatch criteria that was met. Our new dispatch software that we're going to utilize in the call taking process is a teletriage system that allows you to medically triage people more in depth on the phone. What we're seeing now and why it's so important to see that we need equalization now, the outcomes of those patients that were transported, the 100,000 that were deemed to need an ambulance with a paramedic, by the time they assessed them and got them to the hospital, only 65,000 of those actually required a paramedic treatment. The BLS outcomes that were dispatched at 41,000 turned out to be 114,000. So we're not proportionately matching up our calls, and that's where you can start to miss critical events. And 58,000 of those responses resulted in no transport.
The firefighters said today, earlier in the press conference they had, that their paramedics are spread far too thin across the city, and that Philadelphia is not up to the national standard when it comes to service levels and response times. What do you say to that?
I agree, and I agree because they're concentrated on too few ambulances. Do I agree that we are in need of improving our response times in total? To some calls, yes. And that's where the increase in the quantity of ambulances is going to allow us to do that. If we're going from, for an example, if we're going from 48 ambulances on daylight to 53, if we're going from 45 ambulances on the weekends to 53, it's obviously going to decrease the number of times they're utilized, each one, and it's going to distribute them out in quantity. Just by sheer quantity, we're going to, so you call it spreading it thin. I call it concentrating it. I want to spread it. I want to spread the EMS, ALS out into the city versus concentrate. We send paramedics on basic calls because we have too few basic support units. We send the BLS, the basic, on ALS because we have too few ALS. So by distributing that equally, we're going to answer both of those concerns. So.
Folks who can do basic life support. I guess what the fire union is saying is, in their eyes, it makes more sense to just hire more paramedics who could handle more of those serious calls. Do you all that see it in that way?
Well, there's a point in that I do agree with the union. I agree that hiring more paramedics. I do not agree. We agree, at least in the last conversation I had today with the leadership, we agree in this model. What we are not doing is timing it in their eyes correctly. They want to get paramedics onto the engines first. I want to get paramedics onto the SUVs first. SUVs, more agile, they're safer on city streets, they're more accessible, and there's a far less wear and tear on a $40,000 SUV than there is on a $1.2 million ladder truck. So there's all of these are considerations when you look at where to put the paramedics. So in theory, I agree with them that we need more paramedics distributed, and I agree that we are even considering what engine companies to put them on. So I would have to say that I agree. It is a timing thing. Yes, there is an entire plan to bring on more fire service paramedics. That is being excluded from this, other discussions.
But again, the thrust of this plan is to augment the service by hiring these fire service EMTs, pair them with paramedics, as Deputy Commissioner Gallagher said, so that way you spread, your forces evenly throughout the city, so they're not concentrated in certain areas or certain times of the day, so they can respond. You have an EMT, you have a paramedic, they can respond to any call that comes in. That way we put, which we're doing now, we have firefighters who are EMTs who work on the ambulances with the paramedics. That way we put, firefighters go back on the fire suppression apparatus. We have the EMTs who are just EMTs working with the medics. That way the medics, the finite amount that we have, get distributed throughout the city on a more even basis and can handle every call.
Four of these SUVs, is that true?
No, currently 5 is the plan.
That's the initial plan.
That's the initial. So and that is the initial to match the initial change. If we put 20 of these types out there, having 5 of those matches up in capability of backing them up.
Because right now we have 2 lieutenants on 2 supervisors on any particular shift. And given the amount of medic units that we have and the amount of calls, we feel that that's too few. So the city will be divided into quadrants geographically, and each quadrant will get a lieutenant, and then a captain will be overseeing all of that. So these will all be paramedics, so they'll have that level of training, and they'll be responsible for their geographic area, and they will be able to be force multipliers, as the Deputy Commissioner said.
One of the things that happens with our current 2 supervisors, the current 2 for the entire city, one of them at certain points in the day, whenever we're at a low ambulance criteria number, below 10, that operations supervisor leaves the city field and goes into the communication center to help manage resources from that perspective. Our plan includes putting a captain on each shift in the dispatch center so that we don't lose that. So that's going to be 4 new positions there and 5 field positions. So in a sense, they're all new positions, and we're expanding it. So to answer the question about just there being 4, no, it's 5. And secondly, there's 4. To keep them in the field, we have to address, as I said earlier, on the other side, keeping them from going into the communication center to deal with things there, like we do now. So we want to put them in there as a preventative measure so that we can keep them out in the field. And as this is integrated in, this all isn't going to happen in one day. This is going to take probably over a year. And as we do the first phase of it, we'll measure how many paramedic backups were needed while the paramedics are still staffed the way they are with their current partners. And then we'll move to the next one, see if we need more paramedic response units. Or, as the union is requesting, that we look at paramedic engine companies.
All right? We're good?
Okay.
Yeah?